Good afternoon. It gives me great pleasure to speak to you all today and to celebrate everything this occasion says about our university, both as a centre of medical excellence and as a community committed to helping others and to transforming lives. Our £2 million fundraising campaign to purchase Scotland's first MRI-guided focus ultrasound scanner was ambitious, but having completed it, we're now able to bring this innovative research and treatment opportunity to patients. We would not be here today without the unwavering support and patience of our donors, many of whom are joining us now. To all those donors and everyone who has worked so hard on delivering this fabulous project, I'd like to thank you all for your vision and passion in bringing it to fruition. Thousands of patients in Scotland suffer from disabling tremors because of essential tremor, Parkinson's disease, or multiple sclerosis. Currently, the only effective treatment available is invasive neurosurgery. Indeed, only a minority of sufferers are fit enough for surgery, leaving the majority to live with their disability and live essentially diminished lives. For this significant group of patients, MRI-guided focus ultrasound is a life-changing treatment with no need for surgical incision. We want to place Dundee at the forefront of this emerging technological revolution, and we're uniquely placed to be at the heart of non-invasive neurosurgery developments. By bringing together the excellence of the university's clinical research imaging facility, clinical research centre, Division of Neuroscience, and Institute for Medical Science and Technology, Dundee has the international level of expertise and skills required for the immediate use and further development of MRI-guided focus ultrasound research and treatments. Dundee has a history of leading the field of functional neurosurgery in Scotland, having been the first centre in the country to perform deep brain stimulation in 1993. I'm immensely proud to be principal of a university with globally recognised strengths that enable us to transform lives, and that is what we will undoubtedly do in this sphere. Once again, I'd like to thank everyone that's helped to make this project a reality and to wish all of you the very best to help drive this forward into the future.
Dear colleagues, I am really delighted to be joining you all today, even if virtually, as we celebrate the installation of the first MRI-guided focused ultrasound scanner in Scotland, here in Dundee. As the principal has said, Dundee has a history of leading the field in functional neurosurgery, having been the first centre in Scotland to perform deep brain stimulation in 1993. MRI-guided focused ultrasound will now complement this therapy by offering a non-invasive alternative for those people with disabling tremor. This technology also lends itself to other conditions where a non-invasive approach can be used to minimise the pain and discomfort of major surgery. I know my colleagues in the School of Medicine are really excited by the research opportunities this technology offers, as we continue our efforts to discover new, non-invasive means of both treating and preventing disease. This development builds on the outstanding research and teaching environment in the medical school and university. In the last few years, we have been ranked first in the UK for medicine and in medical technology, ranked as the most influential scientific research institution worldwide in pharmaceuticals, and fifth in the world for field-weighted citations. The School of Medicine has secured nearly 120 million in research awards in the last few years, and a number of our researchers have featured in the Reuters Clarivate Most Highly Cited Researchers list, a remarkable achievement for a university of our size. The roots of this success are, I believe, embedded in the culture of the medical school, whose core purpose is to transform lives, locally and globally, through the creation, sharing, and application of knowledge. Our mission in this respect is made possible only because of the co-location and close collaborations that exist between the university, NHS Tayside, and the people of Dundee. The Tayside Centre for Neuroscience exemplifies this collaboration. We have built on the outstanding discovery research into Parkinson's disease, led by Professors Dario Alessi and Myrtle Murcutt of the MRC Protein Phosphorylation Unit in the School of Life Sciences. My colleague, Dr. Esther Zamler, in the School of Medicine, is then translating this research by developing new assays to detect unique forms of Parkinson's disease revealed through this research program and targeting new treatments against it. Dr. Tom Gilbertson in the School of Medicine, who you will hear from next, will now add to this impressive example of bench to bedside research through his developing research program and the new possibilities opened up by MR-guided focused ultrasound. And in all of this, Tom will be working alongside colleagues in the NHS, Mr. Kismet Hussein Ibrahim in neurosurgery, Dr. Ian Morrison and his colleagues in neurology, and Professor Douglas Steele in imaging, clinical colleagues in Edinburgh and Glasgow. These are all key to the multidisciplinary approaches needed to bring projects such as this to fruition and to treat complex diseases of the brain. This project would also not have been possible without the support and efforts of the NHS executive team and NHS Tayside, who I know are committed to providing outstanding neurological and neurosurgical care for the people of Tayside, Perthshire, Angus and Fife. We have also been collectively supported by the university executive and the other schools in the university, the external relations team, who have helped us coordinate our fundraising efforts and enabled this project. This partnership working between NHS Tayside and the university is vitally important to innovation in healthcare, and I'm grateful for their continuing support. Finally, I wish to express my sincere gratitude to all our donors who have helped bring this exciting technology to Dundee. I believe we now have in place the skills and infrastructure to become the first national centre for non-invasive surgery, providing research-led treatments for patients throughout Scotland with diseases such as Parkinson's, and this will add to our growing international reputation for impactful research that transforms lives.
How do you understand the significance of focused ultrasound technology for patients with movement disorders? Well, you have to think broadly about all the things that you and I take for granted on a day-to-day basis. To be able to feed yourself, to be able to care for yourself independently. For patients with Parkinson's disease and essential tremor, this is something that they cannot take for granted, and an indignity that they have to live with every single day. To have a treatment which harnesses the physical properties of sound to penetrate deep into the brain and to restore normal movement feels almost like it has a magical quality. And yet for the patients that have the first neurosurgery using focused ultrasound in Scotland, there'll be no scalpel, there'll be no anaesthetic, and there'll be no need to even stay in hospital. In the course of a 4-hour procedure, they will go from being dependent upon their loved one or carer who can be present during the procedure to being able to restore a level of independence and dignity that is their basic right. Crucially, for the many patients who would otherwise not consider invasive forms of functional neurosurgery, this becomes a meaningful and realistic intervention to change their lives completely. The focused ultrasound system allows us to be the only site in Scotland to be able to deliver non-invasive functional neurosurgery. And by doing so, we join an elite group of medical schools and hospitals across the world who provide this exciting and novel treatment. This places us in a unique context for both research and training the next generation of neurologists and neurosurgeons in delivering this cutting-edge treatment. We hope that this technology we'll be able to use to map the function of the deepest parts of the brain and to uncover new targets for functional neurosurgery in different patient groups and for symptoms that are not uniquely related to abnormalities of movement. Our aim is to treat the first patient in Scotland in May this year and to continue treating one patient a month over the first 12 months of the system's lifespan.
Well, it all started at college at the refectory. It was my turn to get the teas, and I went up and I got the 2 teas, and I'm walking back carrying the 2 cups of tea when my one hand started to shake. I brought the other hand over to try and steady it with the other cup, and both cups collapsed and all the tea spilt out on the floor in front of everyone in the canteen. And yeah, that was 50 years ago. And even today, if I carry a mug of coffee or tea, I can sometimes get violent tremors, and I can decorate the walls of a room. I had no idea what the condition was. I didn't discuss it with anyone. I learned to live with it. I learned to hide it. And partly because I was often working abroad, I never saw a doctor about it. It would be some 10 years later that I was prescribed with propranolol, and another 15 years when I was tagged with essential tremor. I would manage my life to avoid situations, and this is the dark side of essential tremor. I never went out for coffee, so I completely missed out on the coffee revolution of the 90s. I would avoid visiting friends. Holidays are a problem, as B&Bs are out of the question. Self-catering is always my preference, as I can control what I eat and drink. Going on dates needed lots of careful management. Had to watch what I ate. Peas and soup were a nightmare. It was easier to go out for dinner and not lunch or coffee, as I could have an alcoholic drink in the evening, which suppresses the tremor. Functions were especially difficult with lots of people there, and I was never happier when they were cancelled. So using keypads in car parks, PIN numbers, on your phone, on the computer, they're all difficult. And a mouse can take on a life of its own. I also like to cook, but that can get a bit messy in the kitchen, and trying to land a poached egg on the plate, never mind the toast, has become a real challenge. Yes, I can live with the grandchildren commenting on my wobbly hands. We just make a joke of it. In fact, in the last few years, thanks to my to fabulous support from my partner Anne, I've outed myself. So now I don't go out anywhere without straws, and you can see me drinking cappuccinos, wine, beer through straws. I also ask people to carry my drinks for me and to put in the sugar and milk. It drains your confidence, and this did impact my work. I would avoid public speaking and presentations. Even just writing on a flip chart or a whiteboard was difficult. Signing any sort of documents was also very, very difficult. I would avoid staff restaurants, as dishes and drinks on a tray are just a big no-no. I would just eat a sandwich at my desk on my own. Getting the coffees in plastic cups on those cup holder trays was just out of the question. In the end, I just took early retirement. There's a whole list of things I can't do. I can't draw, paint, take steady photos, look through binoculars. Some sports like badminton, darts and snooker are difficult. DIY is a real struggle. I can't play the piano, I can't use a razor, I can't give out medication. The list is just endless of the things that you can't do. The treatment offers a real chance for me to re-engage with the world and come out of those dreadful shadows to socialise more and enjoy socialising. And depending on the level of success, I might be able to do a lot more of those tasks and hobbies that I once enjoyed. I would, for example, love to do an immersion course run by my Gaelic teacher on North Uist. The MRI guided focused ultrasound treatment pioneered by the university is a fantastic opportunity for thousands of essential tremor sufferers here in Scotland and provides a great alternative as well as an addition to the deep brain stimulation already available on the NHS. I feel I've known Dr. Gilbertson for a long time and have shared some of his challenges along this pioneering road. He and his team have been very thorough, carefully guiding me through the expectations and possible adverse events. No doubt I'll be a little nervous on the day, but it's great and it's exciting. It will be a fascinating day that I'm sure will be of huge interest to many, not least to me.